Before you start, exercise caution. You should always speak with your doctor before you start, stop, or change any part of your healthcare plan, including physical activity, exercise, or therapy. This video cannot and does not contain healthcare advice. It is for general informational and educational purposes only. Use of WhisperSLYDE is solely at your own risk.
Standing abduction, soft knees and the foot in the back. And notice how the support leg is slightly bent and pushing out to the side. Repeat this 10 times. This is standing, soft knees, hip abduction on the right. You can do 10 reps. The knees are not fully extended. Standing, soft knees, abduction, forward. Notice how the support foot is in front of the device and pushing out. Repeat this 10 times. This is standing abduction, squat, backwards with the support leg standing behind the WhisperSLYDE. Notice how the leg is bent to about 70 degrees knee flexion. I'm just going to repeat this 10 times. Hip abduction squat. Notice how the knees are bent probably to 70 or 80 degrees on the support leg, and repeat this 10 times. Abduction squat forward. Notice how the support leg is bent probably to about 70 degrees and she's pushing out to the side. She's going to repeat this 10 times. Supported abduction, so she has the strap hanging there, allowing her to get more hip flexion and knee flexion, pushing out to the side. She's going to repeat this 10 times. Let's add some rotation into the hips. Standing hip adduction. She is standing halfway with the support leg along the WhisperSLYDE and pulling her leg towards. And repeat 10 times. So standing hip adduction, standing in front, knees are slightly bent, and she's pulling her leg in towards the middle, repeating 10 times. So standing hip adduction, standing in front, knees are slightly bent, and she's pulling her leg in towards the middle, repeating 10 times. Hip extension diagonal, so we're getting the hip abductors working and the hip extenders using the chair for balance. She's going to repeat this 10 times. Diagonal hip extension and abduction. She's standing 45 degrees to the central plane, pushing backwards and out to the side. She's going to repeat this 10 times. Knees are slightly bent. Hip extension diagonals with the trunk flexed to 40 degrees. Stable leg is slightly bent. She's pushing backwards and out with the trunk flexed, meaning she's going to bring in her lower gluteals more. Repeat. This is hip flexion. Coming on up, core is engaged. She's going to repeat 10 times. Downward dog. She has both feet on the slider. Core is engaged. She's going to repeat this 10 times. Hip extension erect, but using the chair for balance. Notice how the support leg is slightly soft with the knee bent. She's pushing back 10 times. Using the chair, this is hip extension with flexion, getting the gluteals coming in. Her base is hip width apart for stability, and she's going to repeat this 10 times. Trunk is flexed to 40 degrees. Standing soft knees, central hip extension. So notice how the support foot is in the middle, pushing back, requiring some core. She's going to repeat this 10 times. Hip extension with a narrow base. Notice the support foot is on the ground beside the WhisperSLYDE. She's pushing back, standing erect, and going to repeat 10 times. Hip extension, wide base. Notice how the support leg is out to the side to provide stability. She's standing erect, knees slightly soft, and she's going to repeat this 10 times. Hip extension, central flexed. Notice how the trunk is flexed to bring more of the gluteals in. Her support foot is in the center, and she's going to repeat this 10 times. Hip extension with the narrow base and the trunk flex for more gluteals. She's pushing back, knee is slightly bent, and she's going to repeat this 10 times. Hip extension, trunk flexed, wide base. Notice how the support leg, her left leg, is slightly bent, standing wide, and she's going to repeat this 10 times. Standing hip flexion, notice her stable foot is halfway down the slide, and she's pulling the slide towards her using her hip flexors. The stability required in her left hip. As she does it, she's going to repeat this 10 times. Kneeling hip adduction. Notice how she's kneeling on a soft pad and bringing the leg across. She's going to repeat this 10 times. Kneeling hip flexion. Notice how she's kneeling on the soft pad on the left, halfway up the slide, WhisperSLYDE, and then her right leg is pulling forward for hip flexion. Sitting lateral rotation to the right hip. The idea is that the foot comes across and the upper leg rotates without the knee moving too much across. And repeat this 10 times. Sitting medial rotation of the right hip, and the idea is to rotate the foot out so the thigh is rotating in, and that's why she's holding her knee to try and minimize the side movement of the knee. You may need the WhisperSLYDE fixated on that right side, the left of the screen, to stop it sliding. Supine bridging comes up, core is engaged, transverse, and she's going to repeat this 10 times. Dynamic downward dog. So core is stabilized, neutral position, coming up, resisting, going out, the wall is used for stabilization. Standing hamstrings, the heel is on the buffer on the train, the foot is behind or further back on the train, making the hamstrings work. So we're doing back hip pull-ins. Notice the wall is stabilizing, the train is going across, the knees are slightly bent. This is front hip pull-in. So it's using the wall as stabilization, the foot is in front, the knees are slightly bent. Central hip pushback, so the knees are slightly bent, the toes are up on the buffer, the foot is standing in the middle, the pelvis stays relatively still. This is diagonal hip push out, so notice the foot is to the side of the head, there's a slight angle, so they're pushing into extension and out to the side. Narrow glute pushback, so the trunk is forward at 40 degrees, the foot is standing to the side of the head, forefoot pushing back on the train, knees slightly bent, and the pelvis remains relatively still. Wide glutes Pushbacks, the trunk is bent forward at 40 degrees. The forefoot is on the train, and the stabilizing foot is wide in relation to the WhisperSLYDE. This is narrow hip pushback, so the foot is standing slightly to the side of the head. Forefoot is on the buffer. Hips are remaining relatively still, pushing back. Wide hip pushbacks. So the foot is standing at hip width, wide. Forefoot is on the buffer, pushing back, and the hips are remaining relatively still with the knees slightly bent. This is back hip push out. Notice the foot is back, the knees are slightly bent, the pelvis is not moving, and the right leg is just pushing out to the side. This is central hip push out, so the knees are slightly bent, the stabilizing foot is on the head of the board, and we're just pushing out and keeping the pelvis stable. This is forward hip push out, so notice how the foot is further forward of the head of the slide, but it's using the wall as a stabilizer. Again, the hips remain stable as she's pushing the right leg out. This is hip sideways center, so the stabilizing foot is on the headboard, the hips don't move, and the knees are slightly bent. Sitting hip lateral rotation, the WhisperSLYDE is held against the wall. The idea is to have the thigh not move too much and just rotate, and the ankle is coming in. There's some adduction here as well. This is sitting hip internal rotation. The idea is that the knee doesn't travel too far to the side, and the top part of your thigh is just rotating as the ankle goes out to the side. Sitting double hamstring, so the heels are on the buffer, they're pulling back, sitting on the edge of the chair, and the WhisperSLYDE is fixated to a table with the strap. Sitting hamstring curls, this requires the WhisperSLYDE to be fixated to a table chair or something so it won't slide back. Here we are using a belt around the table, and now we can pull back using hamstrings. Double knee extension sitting. Notice the heels are in, the toes are up, and either pushing out or one knee can control the other. Sitting knee extension, notice the chair is in the hole for stabilization, and the heel is on the buffer, pushing out into knee extension. This is diagonal hip stability and extension. The left hip is actually working probably harder than the right, and the pads used for equalization of the platforms. Kneeling hip extension and hip stability, using the wall still to stabilize and the pad to equalize the platform heights. This is kneeling hip abduction, using the pad to equalize the platform height and the wall to stabilize the WhisperSLYDE. Trunk tucks, so the WhisperSLYDE is held against the wall for stability, the trunk is held stable, and then the knees are coming up under the chest. Standing trunk flexion, so both feet are on, the back of the board is stabilized by the steel, so there needs to be some stabilization there, and then the hands obviously are stabilizing, and this requires a lot of trunk control. This is hip flexion, so we make sure that the support of the standing leg is halfway down the WhisperSLYDE, and the action is we're making the left hip pull the left hip forward into hip flexion on the left. So this is resisted left hip flexion. The WhisperSLYDE is held against the wall. You're going to repeat 10 times. So this is hip flexion, so we make sure that the standing leg is halfway down the slide, so we're making the right hip flexors pull the right leg up towards the left leg. and back, and we're going to repeat this 10 times. Need to make sure she's hanging on to something stable and the WhisperSLYDE is held against the wall. So this is hip extension oblique, which is affecting the lateral rotators, the hip extenders, and the abductors. So she's standing at like a 45-degree angle, and she's going to repeat 10 times. This is hip oblique extension. So Kathy's standing at a slight angle, so she's pushing out and backwards. So we're going to repeat that 10 times, standing on the left leg, active leg is the right. This gets the gluteals working, lateral rotators, and hip abductors and extenders. Repeat 10 times. Oh, this is hamstring pullbacks. So the foot is halfway down the slide. This time the main foot we're using is the left. She's hanging onto the chair for stability, and she's going to repeat this 10 times. So we're doing pullback. This time the active leg is the left leg standing on the right. She's standing halfway down the slide, so the hamstrings are engaged. So just pull on back, Kathy, so you can do that 10 times. That's good. So this is hip pullback, mainly using the hamstrings. So the main thing is to have your foot about halfway down the slide, which Kathy does, standing on her good leg, and she's going to pull the right one back and repeat about 5 times, 10 times. So this is the pushback for the left hip with her trunk bent forward to make the gluteals work more. So the leg working the most is going to be the left, although the right is stabilizing. We'd repeat this 10 times.
This knee's supposed to be bent.
So both knees are slightly bent. This is hip extension with the trunk flex. So just bend on forward, Kathy. Just come on over the chair a bit. There you go. And now push on back. And you're going to repeat this 10 times. The fact that she's bent forward makes more of the gluteals work. So doing hip pushback with the left leg standing on the right. The affected leg would be the left. So you're just pushing back at your own pace. And we're going to do that 10 times, keeping your pelvis reasonably still. That's good. Stabilized, obviously, with the chair. This is hip pushback, so you're just standing on your good leg, which is on the left, and now just sort of keeping your hips still. Kathy, just going to push it back. There we go, good. There, stop there, good, and come forward, and you're going to do it 10 times. Doing hip push-outs, so she's standing on her good leg, which is the right, keeping the pelvis reasonably stable, pushing out as far as she can comfortably go. The knees are slightly bent, and she's going to repeat this 10 times. So sitting hamstrings, the WhisperSLYDE is stabilized with the belt and the leg of the couch, and she's pulling back with both legs. She's going to repeat 10 times. For the left hamstring, the WhisperSLYDE is held against the couch with a belt stabilizing so it won't slide back. She's using her left leg, obviously, pulling back, repeating 10 times. So this is right-sided hamstring, and what we've done is secured the board with just a regular belt around something sturdy like the base of the couch. She's hooking her heel under and repeating 10 times for the right leg. This is sitting lateral rotation of the left leg. The WhisperSLYDE is WhisperSLYDE. This is sitting lateral rotation, and then we have the WhisperSLYDE stabilized against the wall. There's minimal adduction of the hip. It's mostly just lateral rotation. I'm going to repeat 10 times. So we're doing lateral rotation of the right hip, and then the idea is that the femur rotates. There's some adduction there, and she's going to repeat this 10 times. Okay, we're doing medial rotation of the hip sitting. This is the left hip, and then the idea is we're rotating into medial rotation. There's some abduction going out to the side here as well, and we're going to repeat 10 times. Done. So the WhisperSLYDE is held against the wall. We're doing medial rotation of the hip. The idea is the femur just rotates and the foot moves out, and there's a little bit of abduction there. She's going to repeat 10 times. Sitting quads push out. This is bilateral, so she's sitting right on the edge of the chair. The board is stabilized against the wall. The heels are on the buttress. The toes are up so they won't slip. She's going to repeat this 10 times. So this is sitting quads push out on the left. The foot is on the buttress. She's going to repeat this 10 times. The WhisperSLYDE is against the wall for stabilization. So this is sitting quads push out. Notice how the chair is in the hole. So the left leg of the chair is in the hole for the left leg. So she's pushing out. She's going to repeat this 10 times and doesn't need the WhisperSLYDE stabilized against the wall. This is quads push out sitting, and notice how the leg of the chair is in the hole on the end plate for stabilization, so you don't need a wall to stop the WhisperSLYDE moving away as you resist. She's going to repeat this 10 times. Quads push out on the right, so you're just pushing on out, and then when you keep your toes up, then it won't slide off the buttress. So you're going to repeat that 10 times.